What is Medicare Part D? Medicare Part D is optional prescription drug coverage. It helps you pay for outpatient prescribed medications. Part D is sold by private companies that are approved by Medicare. So you may be wondering, am I eligible for Part D coverage? Well, if you have Medicare Part A and Part B, then you are eligible to get prescription drug coverage through an individual policy or as part of a Medicare Advantage plan. Do you need prescription drug coverage? Well, if you have original Medicare, Part A and Part B, or a Medicare Advantage plan that doesn't include drug coverage, then our recommendation is that you probably should get a Part D prescription drug coverage policy when you're first eligible, even if you don't take a lot of medications. Unfortunately, our health isn't guaranteed, and as we age, it's likely that we'll have an increased need for prescription medications. And I probably don't need to tell you that prescriptions are very, very expensive. Expensive enough that prescription drug coverage probably does make sense. Now, again, don't wait. If you wait to get coverage, then you'll have to pay a penalty, which results in a permanent increase in your monthly premium. So as soon as you're first eligible, go get that Part D, even though you might not be taking a lot of prescription medication at that time. So next you're probably wondering how much you'll pay for Part D Medicare drug coverage. Well, the amount you will pay for your premiums and your medications is going to vary, oftentimes dramatically, from plan to plan. Here's a look at the typical expenses you're going to have. The first one is your monthly premium. Now, nationally, the average Part D premium is about $31.92 per month. But that, again, it varies widely from company to company and plan to plan. Part D prescription drug coverage isn't standardized. There are plans that offer significantly more coverage with fewer out-of-pocket expenses, but those plans will have a much higher premium. Other plans will offer less coverage for a lower premium. What you have to do is choose which plan makes sense for you. So your premium is going to vary based on what choices you make. The next thing is your deductible. Some Part D plans have a yearly deductible, which is currently limited to $310. Then there's co-payments and co-insurance. Most plans include some form of cost sharing through co-payments or co-insurance for each prescription that you have filled. Typically, co-payments are a flat rate and co-insurance is a percentage of the prescription's cost. You'll most likely pay less for generic drugs and significantly more for brand name and specialty medications, not unlike the prescription coverage that you have in your employer-sponsored plans before you retire. Okay, what is this donut hole that we've all heard about? Well, most Part D plans have a coverage gap, which is commonly referred to as the donut hole. Works like this. After you've spent a certain amount, which in 2010 is $2,830, you must pay all of your own drug costs until you hit the catastrophic limit, which is $4,550 in 2010. Once you reach the catastrophic limit, then most plans will cover the majority of the drug costs that you incur within that calendar year. Now, there are some plans that offer some sort of coverage in the donut hole, right? Most will offer no coverage in the donut hole. The plans that do offer coverage there are typically a lot more expensive. Your deductible, your co-insurance, and your co-payments all count towards that $4,550 catastrophic limit, but just be aware that your monthly premiums don't. So in 2010, if you have expenses in the donut hole, Medicare is going to send you a one-time tax-free $250 rebate if you're not already receiving Medicare Extra Help. In 2011, you'll receive a 50% discount on brand name prescription drugs once you hit the donut hole, if you're not receiving Extra Help. So the next question we get a lot is, What pharmacies will I be able to use? Well, typically each prescription drug plan will have a network of pharmacies that you will be required to use. So making sure that you can use a pharmacy that's convenient for you is obviously an important consideration when you're evaluating Medicare Part D plans. Another frequently asked question is, will my prescriptions, the ones that I'm taking right now, be covered? Well, again, each plan has its own formulary, which is a list of prescription drugs that it covers. You can use the formulary finder to find plans that will match the medications that you are currently taking. Just go to Google, search formulary finder. For your state, you'll find it. Now, many plans will categorize drugs into tiers with different price points. So for example, generic drugs may be categorized as tier 1, while non-preferred brand name drugs may be considered tier 3. Again, tiers aren't standardized, so a particular drug may be considered a tier 2 drug on one plan and a tier 3, meaning more expensive, on another plan. So if a plan you're considering uses a tier system, it's important that you know which tier your prescriptions are in so that you can effectively evaluate your potential expenses. Your plan could also include something which is known as step therapy. So if it does, you may initially be prescribed a similar but cheaper medication. If that medication doesn't work effectively, then you'll be stepped up to the more expensive drug. There may also be quantity limits on how much medication you can receive at one time. Some categories of drugs are excluded. These drugs include prescriptions taken to gain or lose weight, promote fertility, increase hair growth, or for cosmetic purposes. Inpatient drugs, barbiturates, which are sleeping pills, benzodiazepines, which are central nervous system depressants, drugs for the relief of like coughs and colds, prescription vitamins, except for prenatal vitamins, all those are typically excluded. Now, another question, what if I have coverage through an employer or a union? Well, if you have coverage that is at least as good as or better than Medicare's standard prescription drug coverage, then it may count as creditable prescription drug coverage. And if it does, then you should be able to enroll in Medicare Part D plan at a later date. And the reason you might do that is if for some reason that plan became no longer available through your employer or your union, you would still be able to enroll at a later date without incurring a penalty. So your best bet there is to contact your benefit administrator before you make any changes to your coverage. A lot of times we're asked, when should I join a Part D plan? Well, let's talk about your enrollment window. Your 7-month initial enrollment period is the best time to sign up. Because if you don't join when you're first eligible, you can still enroll in the Part D open enrollment period, which is from November 15th to December 31st each year. But unless you've had what I just referred to as other creditable prescription drug coverage, then you may have to pay a late penalty if you fail to sign up when you're first eligible, and that penalty is typically a permanent increase in your premium, so you don't want that. Finally, will I be able to switch plans? Another commonly asked question. Well, you will be able to switch plans during that open enrollment period between November 15th and December 31st of each year. You don't have to notify your current drug plan that you're switching plans. Your old coverage just will automatically end when your new coverage begins. So that's some of the most frequently asked questions we get on Medicare Part D coverage. Hopefully you found that helpful. If we can help you with anything else, please don't hesitate to give us a call at Snyder Advisors. Our number is 888-6-SNYDER, or you can find us on the web at snyderadvisors.com.